Thank you, everyone. It's a pleasure to be here today and to share a little bit of the behind the scenes that went into the development of a smart litter box monitor, which now has practical applications in many areas. You'll hear a bit from our colleagues today. You've already heard a little bit from Dr. Winston, and then you'll hear from Dr. Quimby and Saffire of how this tool is coming to use for their purposes, but I'm excited to share a little bit about what went into it so you have that background. So the number one question people ask me is why? Why would your team dedicate literally over a decade of research towards understanding the intricacies of cat elimination behavior and then dedicate an enormous amount of time to develop a tool to measure, automate the process of tracking cat elimination behavior and weight, when cats do all sorts of interesting things, like why elimination behavior? And I always say that, despite something that's usually hidden away in the house, pet owners don't want us to see the litter box. The litter box is actually a window into what's going on with the cat in terms of their health and their well-being. And often the earliest indication of any sort of behavioral change or health change with a cat manifests as some sort of change in their elimination behavior. So if we have a way to monitor this, to keep tabs on this, we can actually find very insightful information, early indicators that something is going on with our cats in a very easy way. And with a litter box monitor, you can do this through passive data collection. So that's the why. When we think about how this relates to health state specifically, the cats, because they are both a predator and a prey species, they have this ability to really hide their symptoms. People also aren't the best at reading cats, so even if they're trying to tell us, pet owners often miss it, right? Dogs can be big and boisterous and tell us like, hey guys, this is happening to me, now I'm limping, or now I'm doing this. For cats, they're much more subtle. People are missing it. So the truth is that often for something, let's say, you'll hear much more from Dr. Quimby soon, but something like renal disease, by the time pet owners are actually noticing these subtle changes that they would see in home, they're not so subtle, and the disease has already progressed to the point that about 2/3 of the nephrons probably are impaired. And then we're talking about a treatment plan. There's not much that you can do, to prevent the progression at that point. So if we could have a really early indication ahead of all of that and get people into a vet clinic early, it would be a very valuable tool. And I don't want to limit to just urinary or digestive health areas. There's all sorts of health areas where we see changes in elimination patterns and weights. This is something that veterinarians, as you guys all know, are asking clients when you're bringing their cats into the clinic, have you seen changes in these things? So if we had a way to actually have that information, it would be fantastic. And although we want that information for diagnosis and then also to look at how our treatment plans are actually impacting our clients, it's difficult to get. As a veterinarian, you're seeing this cat when they come into the clinic. How often? Annually, hopefully, maybe more often if you're managing a disease state. You're asking your pet parents, have you seen any changes in these? Usually they're probably saying, no. It's a big hurdle for them, right? So if we could have a tool to be able to provide that data and information, a window into the home for this cat, it can be quite valuable. So why is it so hard to have this information? Well, even pet owners, if you ask them, they're not really understanding what's going on with their cat in the litter box. How many people watch their cat in the litter box? A few. You guys are dedicated cat owners. Thank you. How many people have their litter box tucked away somewhere in the house that no visitor coming to the home would ever see the litter box? More, right? How many people have cats that, because they are also a prey species, they're putting themselves in a vulnerable situation when they eliminate, so they might not like to eliminate in a high traffic area where there are people around. So you have the litter box in the furthest corner of your house where they're not disturbed when they're eliminating. A few of you. So because of all these things, the limited direct observation, the fact that cats are crepuscular and so they're gonna have nocturnal voiding, all of these issues makes it really hard for a pet owner to keep track of their cat's elimination behavior. On top of that, how many people have more than one cat? A lot, right? And so it's really difficult to know which cat is actually eliminating when and track those patterns if you don't have a tool to do so. There are some solutions out there. So a number of people, even in this room, have tried things like, well, one, deploying cameras, right? So if you have a camera on the litter box, you can, in fact, track exactly what's happening in that litter box and glean information, insights about the cat's behavior and health. But someone has to watch all those videos, right? And then be able to interpret said videos. Also, a lot of pet owners don't want a camera around their litter box because they have a litter box in an area of the house where they wouldn't want a camera. And if you ask pet owners to estimate eliminations, they're really not that great of that. Evidence has come out when we've actually asked them to log exactly what they're scooping out of the box. Their perception of what their cat was doing and what they actually log can be wildly different. But evidence does point that if a pet owner is managing a health condition for their cat, something like chronic kidney disease, they are much more aware, likely because their veterinarian has told them to keep tabs on something like that. So for them, they are better at estimating, but if we could have a tool to automate the process, the data would be much more accurate and much more rich. So this was our goal, to really design a way to passively collect data from cats on their elimination behavior and changes in weight over time, and create a tool that could be deployed in many situations to really provide this information. We've talked a lot today about different types of AI, specifically machine learning. I won't deep dive into those because you've learned a lot already today, but for this we were using machine learning, supervised data. The key to impactful, insightful AI, especially machine learning, is the truth data, the quality of the truth data that you're feeding into the engine to build these models. And so in our case, it took an enormous amount of data. So essentially we created a platform which has load cells which can sit underneath a litter box, and we're trying to ask this machine, tell us what is going on in this litter box on top of you, only from load cell data. In order to do so, we actually acquired over 750,000 cat elimination events. We videoed them. We had a team of labelers that painstakingly labeled everything that was going on. We did this over more than 4 years, 24/7 data collection in every kind of scenario we could, with single and multiple cats in a household, in different environments, with different litter types, with litter box types, to have the most variability, the most robust data set possible to build very strong models to be able to predict these things. So as an example, this kitty cat, her name is Marilyn Monroe. What you're seeing is a load cell trace coming from a smart litter box platform that lives underneath her litter box. The 4 lines at the bottom of the blue, green, orange, and yellow represent one corner underneath this platform. The top is the total load, so that red line. So you see she's a busybody, right? She does a lot of things in the litter box. Our previous work around cat elimination behavior, we discovered that cats are actually doing 39 different behaviors in the litter box, and she does a lot of them, even in just this video. But you can see that she's doing a lot of this pre-elimination behavior. So she spends a lot of time finding exactly the right spot, preparing that spot before she even strikes an elimination pose, which she will do in a moment, I promise. She'll strike that pose, and then you'll see that beautiful flat line happening. That's during elimination, that's the point where we can actually take a body weight for her. So there's a lot of noise, a lot of movement going on, but when she's holding still there, we can get that weight. So every time she's coming to the box, we're gonna try to get a weight on her. Now, cats are cats. They're gonna do things like have 3 paws out and only 1 paw in, or be on the edge, or doing all these things. So this is why we needed a lot of data to try to train the models to be as accurate as possible. Right there at the end, you're seeing this little hip flex of her. That's a telltale sign that this was a defecation event. So we're actually extracting features from the load cell data which are indicative of what exact behaviors the cats were doing. In order to do this, we need this strong labeled truth data. An enormous amount of data where we're saying this little squiggle equals exactly this behavior, and then we can train the machine to be smart enough to detect that. So then she goes about her business, she's covering, and then she'll exit the box. In a moment, I'm gonna pull up a second cat. Imagine that Marilyn Monroe was living in the same household as this second cat that I'm gonna pull up. His name is Patrick. Look at Patrick's load cell trace. He's a simple fellow. Marilyn did all sorts of prep work, and then she did her elimination, and then she did all sorts of cleanup afterwards. A very, very busybody cat. Patrick here, this is a very simple load cell. So now imagine if these 2 cats are in your household, how we might be able to use both machine learning and actually deep learning techniques to train this machine to know this cat is Marilyn, this cat is Patrick. They might live in the same house. So we're able to also have algorithms to try to predict which cat it is that is eliminating. And then we do need some help from pet owners. We'll cluster, this is cat A, this is cat B, you need to tell us who is who. So we do ask pet owners to label for us 8 events from each cat. And then at various times, cats will change in their behavior and or their weight, and so we'll ask for relabeling. But just been looking at these 2, you can imagine how this is possible. So this is Patrick. He's got the fancy litter box that has the palm tree on top. So that's the plant that you see coming down. He's going to enter the box, pretty much no pre-behavior. He's sniffing just a little bit. Then he's going to strike his elimination posture right there in the front. This is a number 1, by the way. He's doing that right here. Nice flat spot. We can get a weight on him. And then he has very interesting post-elimination behavior where you'll see that he's going to cover, but not really cover. But he is motivated to cover. So he's satisfying that intrinsic motivation to that paw feel of moving that litter. And he's really trying. He's sniffing, but he's not really trying. And he's out. So now imagine this times 750,000 cats doing cat things. We also are interested in human things, right? So how are people cleaning the litter box? How are they setting up the litter box? Because we know that's very, very important for cat welfare as well. So we also have trained on the human behaviors of maintaining the litter box and what they're doing so that the machine is smart enough to know, is this a cat or is it a human? If it's a cat, what's the cat doing? What's the human doing? So we have cat ID, even in a multi-cat scenario, and we're highly confident up to 5 cats. We've stress tested the system though. Right now we have one household that has 14 cats, and the owner swears that we're doing a fabulous job of identifying them, but all the time we're asking for more cameras to be deployed, for more truth data, to continue to improve our algorithms so that it can get smarter and smarter as we go. And even if you already have a smart litter box, this smart litter box monitor, we can push out updates through firmware where it can keep getting smarter, even the device that you have. So we're tracking which cat it is, because that's what's important, right? So we assign the right data to the right cat, how much that cat weighs, how often they're coming, what they're doing when they're there, the weight of the output of what they're depositing, the duration of time that they were there, and then we're also tracking scoop events. This is a great way to motivate pet owners. As you know, a little bit of gamification. They get badges and things for being great pet owners and scooping out a litter box, and this really does help us to drive continual use and data collection, because there'll be a lot of perfectly healthy cats using the system. Where it becomes really insightful is when that cat is transitioning into any kind of behavioral or health issue. That's the moment we want to catch their data, so we need to make sure that people are using the device. So this is complex. I'm not going to go through a lot of it, but just so you know, an event is registered, which means the load cells wiggle and it wakes it up, and it's going to immediately start to try to figure out what the heck is happening. So it's going to say, is this a false trigger? That could be something like your robot vacuum is vacuuming and it keeps bumping into it, or someone was walking past the litter box and kicked it. So immediately we can tell, is it just a false trigger? Or if it looks like something's happening on the load cells, like something is interacting, then we'll start going down our list of things. Is it a cat or not a cat? Is it a human or something else happening? If it's a cat, who's the cat? How much do they weigh? How long have they been in there? The events. Once we're sure that it is a cat and they're in the box, then we say, okay, are they eliminating or not? If they are eliminating, what are they doing? If they're not eliminating, what are they doing? And here you'll see wobble alert at the top. That's because actually you can have a litter box that's larger than the size of the platform, but it needs to be centered over the monitor for it to function appropriately and not touching any of the walls. So now we've developed a model actually specifically to detect that. If you have a large box that's over the edges, completely fine, but if it's shifted, so now it's not balanced and it's wobbling when the cat gets in and out, we want to alert you right away to ensure data quality and also safety and satisfaction of a cat. You don't want your litter box moving when you're trying to use it. So larger boxes are okay, but we do now have it built in to alert pet owners when they aren't balanced on the monitor. So complex tree that we're going through in order to filter and provide insightful data. Just some examples for those that are interested of what these load cell traces look like in different scenarios. So the first one, cat in a box, that looks similar to what Marilyn was doing. We're also tracking when a cat is doing something outside of the box. This is interesting when cats are visiting a litter box but not actually going in and using it, so we can provide information on that as well. If it's a multi-cat scenario, we're not sure who is doing it because we don't have enough data to understand which cat is interacting with the box, but we can tell you at a household level how much interaction there is with the outside of the box. If it's a single cat household, we're sure which cat it is. We're also tracking the human scooping and then human maintenance events. So how often are you taking the whole thing off and cleaning it and putting it back on? That's what they look like. In the elimination space, which is really what we're fascinated with, these are just examples of an ideal scenario where we see a cat coming in but actually not eliminating and getting back out, a cat with a urination or a cat with a defecation. A lot of cats do what we call combo events too, where they'll do both defecation and urination in the same event. So then we're looking for the different phases to identify that that is happening as well. And we're always asking for feedback from our pet owners. If you are seeing something being misclassified, we ask for help in relabeling so that we can continue to improve the models as we go. Again, the more data, the better. Here's some examples of a cat just rubbing a box, the cat that goes just on the edge of the box but doesn't go in, and then a cat on top of the box. So this is for our covered litter boxes where sometimes that makes a beautiful perch for a cat and they like to jump on top and they're doing something up there, but it is not related to elimination behavior. So we want to be able to identify that as well. But as you might suspect, we can provide all the data in the world to pet owners. And they'll say, so what? What does that mean? So where it becomes valuable is when we interpret that for them. We take our knowledge and expertise and we translate the data and we show them changes over time and what that might mean for their cat. So for this, we're collecting a lot of that profile information about the cat and about the household so that we can then run it through our expert logic to really provide those insights. And so here, at Purina, we have an amazing, vast knowledge around pets. So I can take the same data set and show our behaviorists or our geneticists or our veterinarians or our microbiome specialists or our nutritionists and say, if you were to see this data set and this change in the cat's behavior, how would you interpret it? And we can pull all those mind melds together into what we call our pet expert decision tree logic. So this is how we're filtering the data set to then push insights out to our pet owners. And they will be different depending on the pet profile. So for instance, body condition is a big one, especially for when we're tracking weight changes in a pet. So if we have a very underweight geriatric cat, we're gonna have a very low threshold of tolerance for them losing any weight, right? But if we have some of the cats from Dr. Winston's presentation that it might not hurt them to lose a little bit of weight, we might have a little more tolerance if we start to see them lose some weight. So just an example of how we can take that information about the pet and their profile and then cater personalized recommendations back out to the pet owners. So I hope you see that with the power of AI, so through both machine learning and deep learning and an immense amount of truth data, we've now trained a monitor that can automatically track weight and elimination behavior and then also translate that in trends over time to pet owners or to their veterinarians. And so here we're really seeing the value of that window inside the litter box and what's going on there and how we can move the needle from being just reactive when a cat reaches a certain set of symptoms to being more proactive and tracking them ahead of time to really have that information. So I'm going to pass it off to Jess next, and she'll share how some of this has been working for her.
Great. Thank you very much. It's such a pleasure to be here at the summit as always, and I would love to talk about chronic kidney disease any day. So really what I want to do in my particular session is talk about the applicability for this patient population, right? We have all of these elderly cats with chronic kidney disease, and they have all sorts of comorbidities that can happen associated with their chronic kidney disease. But the one I want to concentrate on today is the constipation piece and looking at how litter box monitors can really help us with tracking behaviors, output, even weight in these patients. And really the piece about constipation, as we've just kind of highlighted, is being proactive as opposed to reactive when it comes to constipation. So very commonly we think about the clinical signs for constipation as being straining, vocalization, even vomiting in the litter box. I would prefer to identify there's a problem before we get to that point. And very much part of my patient assessment for these cats is thinking about more subtle signs. When I do my physical exam, I'm looking at hydration status. I'm actually feeling the feces in the colon. These cats are thin. They're not Dr. Winston's slim cats. I can absolutely palpate their kidneys, and I can absolutely palpate the feces in their colon. And it's usually small, hard little nuggets, unfortunately, right? And when I feel that, I then ask additional questions. What is the fecal score the caregiver is seeing? What is the frequency of defecation that we have? Do we see little things like pooplets around the household? So these are subtle signs of feline distress in the household, but they might be entirely missed by the caregiver. The dog might eat the pooplet. No one ever sees it, right? So I want additional information. I want to be more proactive, and I want to be able to identify the cats before they get to the emergency room. We know that this is something now has been shown in this great study. I love this study because it absolutely captures my feeling, my clinical impression for these cats. Cats with chronic kidney disease are more likely to present to the ER for constipation. They're more likely to be hypokalemic associated with those episodes. So we know we have a huge clinical problem, and I would prefer my patients not end up in the ER. No cat likes the ER setting, of course, and those events can sometimes have devastating outcomes for our patients. So we really started to ask the question, well, how can we get at this ahead of time? How can we monitor these patients? How aware can we get caregivers to be? As previously mentioned, we totally believe that caregivers don't really know what's going on in the litter box. That's hidden someplace in the household, and they're not really clear on what's happening. So we first started off with that defecation study and asking the question of what is happening in the litter box? Could you please scoop the box on a daily basis and tell us what you see in the box, and record this in a survey and then reflect upon what they had learned. And as we mentioned, they didn't actually know what was in the litter box, and they thought that they knew, but when we actually measured, it was not the case. We looked at both healthy cats and cats with chronic kidney disease. These are not actually patients that we had personally seen. It was a nationwide, or actually worldwide study. So we were basing these definitions based on what the caregiver told us. So there's a caveat of the survey. But when we actually touted up how frequently these patients were defecating, it was very common for the normal cat to defecate on a daily basis, even sometimes twice a day, and the chronic kidney disease cat to actually defecate less than that. Not even really daily, sometimes every other day to maybe a couple times a week. And these were not patients that were thought to have an overt problem with constipation. But of course, being a survey study, I need more objective data, and that's where the litter box monitors started to come into place. So we started to look at and utilizing litter box monitors for more objective data in our research program, and that's been a continued area of interest. So being able to know more objectively, well, what exactly were we seeing? So a couple of summers ago, as part of the Summer Student Scholar Program, Zach George, who also is just graduating here on Saturday, will soon be Dr. George. For his summer project, we looked at outfitting healthy cats and cats with chronic kidney disease with their litter box monitoring devices. These were cats that we knew we had done lab work on. We made sure they were stable as much as possible, that they were going to be a good candidate to be in this study. They were given litter box monitors for every litter box in the household, and then we looked, after optimizing the devices, we looked at what happened for the next 30 days. And unsurprisingly, based on our clinical suspicion, we did in fact see that those chronic kidney disease cats went more days without defecating. Even by 2 weeks, you could tell a difference. 3 weeks for sure. By a month, a lot of those cats had days they were not defecating about a third of the time. So they are really missing a lot of days, whereas we have our normal cats who tend to, again, still defecate on a daily basis. So now I have more objective data. This is what this looks like over the course of a month. So again, most of our healthy cats are defecating quite regularly, and we have cats who are literally, sometimes even almost half the time, they're very regularly only defecating every other day. And so this is where we start to ask the questions of, well, what does that really mean for the patient? And again, is this a sign of subclinical constipation? Is it just a decrease in defecation frequency? What's the implication of that for this patient? And from the standpoint of the caregiver, this is what this actually looks like. So you get, I just love this interaction of the caregiver being able to say, this is what's actually happening with my cat. So on the left-hand side, we have Gus. He's what I'd call a super pooper. He's every single day as regular as can be, normal, healthy cat in the box. And you can see his little brown dots are defecation, his yellow dots are urination, and gray dots are non-events. So they go in the box, but they don't do anything. And then Kitty is are going to be our poster child for chronic kidney disease during this presentation. She's one of those cats that the caregiver does not think she ever has any distress in the box. She just simply does not feel the desire to defecate on a daily basis. She's not particularly dehydrated. Her kidney disease is well managed. She's just not defecating on a daily basis. And so she was very typical of that patient population that we're seeing. And when we actually look at chronic kidney disease, it's not a surprise, right, that we would have a change in defecation behaviors for these patients. On the human side, chronic kidney disease is considered slow transit form of constipation, where there's all these factors that play into changing that defecation frequency. It's primarily a water balance issue, right? These patients can no longer concentrate their urine. They're likely subclinically dehydrated, and the body, of course, very intelligently says, well, we'll fix that. And it pulls water out of the colon and tries to preserve hydration in the rest of the body, to the detriment of that feces, right? And then you tend to have longer dwell time in the colon. You have longer dwell time along the entire GI tract, very likely. Hypokalemia, very common in cats with chronic kidney disease. That's also going to exacerbate. I think we very commonly think of hypokalemia, those really severe cases where they're down in their hocks and their heads are down and it's the skeletal musculature that's being affected. But don't forget, all muscle cells need potassium, and those smooth muscles of the GI tract, you're also going to have an effect from hypokalemia there. So we make sure that we hit that target as well. Then, of course, we give medications that actually can cause constipation as well, like phosphate binders. We published a study on that some time back. We tried to study, Lappin and I tried to study this phosphate binder and made things constipated instead. So that was not ideal, but so now we have a reference that says, yes, you can make a chronic kidney disease cat constipated with a phosphate binder. But then also, very importantly, we have this whole idea of the gut-kidney axis that is a huge area of interest for us at Ohio State, because we have a huge GI team and then myself as the kidney team studying the interaction between the two. And thinking about the concept that uremic toxins that build up with kidney disease actually do affect the GI health as well and may slow transit, and like this cyclical aspect. So let's just take a moment to talk about that a little bit more as well, because it really does, I hope, convince you of why I care that maybe even a decreased defecation is a problem, even before we get to clinical constipation. So the gut-kidney axis, this concept that, again, kidney health absolutely affects the gut, and gut health absolutely affects the kidney, and round we go. So we have been studying this quite extensively here over the past couple of years. It was part of Dr. Stacy Summers' PhD project, and we now know that cats with chronic kidney disease have dysbiosis, they have decreased microbial diversity and richness, and they also have increased uremic toxins, which definitely worsen with the greater stages of disease. So when we start thinking about those toxins, as I alluded to, and then they're supposed to be eliminated through the kidney, but they cannot as kidney disease progresses. Those toxins then are going to have implications for what's happening in the gut as well. And this is a story about the colon. This is typically where uremic toxins are going to be developed. The precursors are changed by the microbial community into those uremic toxins that are then absorbed in the colon. So this is where constipation potentially plays quite a role. And unfortunately, those uremic toxins do have multiple deleterious effects. I'm not going to go into this in more detail, just to show you, look at all of the different things. This is just a handful of studies that I've put together on one slide. Hundreds and hundreds of studies have been done on uremic toxins in rodents and people with chronic kidney disease. There, in basic science studies, there are lots of reasons to be concerned about these substances. And when you add the constipation piece back in, it is actually quite interesting because in humans with chronic kidney disease, we do see an association between stool quality and constipation. And the Bristol stool scale, you would definitely have higher uremic toxins. And some of these feed back around then, and they slow your gut down. So we have to sort of consider that there is all this unknown to the gut-kidney axis that might be exacerbating this situation. Where can decreased defecation actually be a risk for this patient, though, clinically? Well, this is Twiggy. She was an 8-year-old female spayed domestic short hair, and Twiggy has been wandering around for several years with IRIS stage 4 chronic kidney disease. She's actually a little miracle. So I saw her just quite recently. She's anemic, she's hypokalemic, she was inappetent, and she had decreased defecation, and she was in crisis. So at this point in time, her creatinine is about 7, and she's no longer just honey badgering on and doing okay like she has been for the last year and a half. Her potassium and her hydration were huge goals for us. We were able to pull things together for her and get her defecating more regularly, and she really flourished for another couple of months. But unfortunately, when you have a patient that's as delicate as she is, when you lose control of the constipation and they have a major constipation event, that can end them up in the hospital, and that unfortunately can be a terminal event. So it can be a very big deal if you lose control of that for these patients. And so we do watch that very carefully. But again, how can we go about doing that? How can we intercede? So there's many, many things we can do about constipation, and I just want to point out, again, this is not the point of my talk. We're going to talk more about the litter box monitors, but this is a huge therapeutic target for us. And so we can get objective data, both for research and for the pet owner, and we can determine response to therapy. So I want to share some of those stories with you. So let's go back to Kitty for a moment. By this point in time now, I've actually been seeing Kitty since 2021 as a stage 3 chronic kidney disease cat. She's a gold star study performer. She's been in lots of different studies. She's actually been outfitted with litter box monitoring devices because Kitty has a tendency to just randomly have subclinical bacteria in her urine. And this is a great way for us to say, do I think there's a problem or not? I again, truly don't believe that people can tell me if the cat is clinical or not, so I feel much better about Kitty having a monitor because Mom comes to the appointment and she shows me the data, and if there's bacteria in that urine and Kitty looks just great, we're like, I don't think there's a problem. Kitty is managed in a variety of different ways at this point in time, her anemia, her inappetence, etc. But so she normally has rechecks about every 3 months or so if she's not on study. And the long-term data that's produced by the litter box monitoring device gives an idea of what's going on. She normally defecates about an average of 1.2 defecations a day, like she's doing pretty well there. It gives us an idea of what her weight is doing over time, what her normal habits are, etc. So again, I get a good idea. Mom screenshots everything, sends me like a little video. We get poop pictures, all sorts of hydration videos. It's great. I love. So it's great. All that information coming into her clinical visit is amazing. However, this last April, I actually got an email about 2 weeks before Kitty's regular appointment, and Mom said, well, I got an alert, and she actually hasn't defecated in several days, which is unusual for her. So if you look back at this graph, she's gone now 4 days without a defecation event, and then she gets an alert that has happened. So she reaches out by email, and she says, I'm a little bit worried about her. She hasn't defecated. And when we pull up her weight data, we can also see that she's been trending downward in terms of her weight. So we immediately respond to that alert, and we schedule her in that week. Actually, the next day we were available to see her instead of waiting for her regularly scheduled appointment. So boop, into the clinic she comes to see what's going on. What has changed for this cat at this point in time? So she's now more dehydrated than she normally is. She's lost that weight and the muscle mass. I confirmed that on my physical exam. And she has a large amount of stool in the colon. Her creatinine is up from where it was before. She's hypokalemic. Ugh, so many things. So we institute potassium citrate, sub-Q fluids, and some Miralax, and get her started on a new protocol. And she actually responds really well to that. Here she is again at home, and I can see on her litter box monitor my response to therapy. So this was the whole reason we did our litter box monitoring study in the first place. A, to prove we have decreased defecation, but then now we can do studies looking at interventions for these patients. So you can see here we kind of go back to Kitty's typical type of scenario. And then you'll notice an uptick in non-events, those gray dots. She then actually got a urinary tract infection for real on top of everything else. So that was the next part of the story that happened right after I put these slides together. So the litter box monitor until us fact that there was a problem, but we were able to bring her into the clinic and make sure that we had everything under control. So it was really, really helpful for her in that particular scenario. So again, proactively knowing that there's a problem, being able to proactively assess that cat sooner, be able to see the response to therapy for them. I think it's also really important from the standpoint of being a caregiver myself. So not only is this important from the standpoint of research and of seeing my clinical patients, but I can also say that it lines up very importantly from the standpoint of, again, seeing interventions. So I just do want to share one last story from the Quimby household. It's almost like a pilot study, because I'll be honest, we have enough cats that, you know, the power is pretty good. So this is Padme. Padme is an ex-research cat, courtesy of CSU and Dr. Lappin. But unfortunately, on January 1st, we were all, sitting around relaxing. Padme used to do this trick where she would run and springboard off a wall. And Padme came tearing down the stairs, went to springboard off the kitchen wall, and I don't know what happened, but she blew her cruciate at the age of 12. Yes, I was literally there for the event. Shrieking. She slides across the kitchen floor, puffy, and I'm like, what have you just done? And I thought, well, this is bad. Padme is actually a very delicate flower. She failed out of research life because she's just such a delicate flower, and she crawled under the bed and decided that because her leg didn't work, she was actually going to die. She wouldn't literally come out to eat or drink. I had to feed her under the bed, and I immediately thought, you're going to get constipated. So here is her litter box monitoring data that shows you that she in fact lived under the bed for 4 days and refused to defecate. I'm palpating her colon going, oh no. And then on the 4th day, I decided intervention was definitively needed, because even taking her to the litter box, she wouldn't go. She can't stand. Like, we're trying to medically manage her, but she's decided she's actually going to die because her leg does not work. So we started basically giving her nutrient-enriched water and Miralax and being very proactive. A lot, mildly waterboarding the cat with I do not want to take you into the clinic. Please, please, please defecate. It worked. Lots of substances later, she had a big defecation event, and look, we're back on. So here we are during this period, we're hiding under the bed thinking we're gonna die, and then suddenly, the pain medications by this point in time have convinced her she will live. She's defecating beautifully. So January 23, I go off to VMX thinking everything is fine. So I'm no longer at home. And my husband is taking care of the cats, and she's recovered. She's now gimping around, but doing well. And I actually stopped the nutrient-enriched water in the Miralax. And I'm at the conference doing my thing, and I look at the litter box monitoring app, and I go, oh, the cat is now not actually defecating very well during this period. So I text my husband, please restart the things. And he did. And here we have response to therapy. So she's now back to defecating every single day, doing very well. So we can tell a lot from these devices. They're very, very helpful clinically. We're going to use them a lot in our research studies. Cats like Kitty, absolutely the key to managing her disease for all different types of reasons. They can tell us when we're doing well with our therapy. They can tell us when we've relapsed from our therapy for non-compliant caregivers. a wealth of information. So I, of course, can't do all of that by myself. So if you'd like to check out our research group, kudos to them, please do so via the QR code. And I'll turn things over to Dr. Saffire to talk about the lower urinary tract. So thank you for your attention.
Hi everybody, I'm really excited to be here as a feline practitioner to share with you how litter box monitoring has been incorporated into my practice and specifically for the area of lower urinary tract disease. So we all know that cats are the easy species to treat, right? Not true at all, right? They're not, they're difficult. When they're sick, they have very vague clinical signs, sometimes very non-specific. There's a reason for that. You know, how many times have you seen a patient, and for me, I have some very, very astute feline owners or caregivers who pay attention to the smallest details, but they still will bring in a patient to me that, you know, came in for a decreased appetite for 2 days, and I take a look at this cat and it's lost significant amount of weight. It's got significant muscle atrophy. Maybe it's dehydrated. And I know right away that this was not a cat that stopped eating 2 days ago, right? And so why is that? What is the reason? And we have to look at cats from a different perspective in that there's a lot about them that makes them very different from their canine counterparts and that makes it really difficult for even the best pet parents to notice small changes at home. This is the first point on here is a little bit up for debate. Cats have a high requirement for hunting. They're not always the most skilled, but most of them are. They have a very heightened sense of smell. They have excellent vision. So for the most part, they're pretty good hunters. They're also solitary survivors. What that means is they don't live with a pack where they have somebody looking out for them, making sure if danger's coming, they all get away, or someone's in charge of hunting for them. They mostly live by themselves. And so because of that, they have this excellent ability to sense and avoid danger, but also means that they can hide illness and they hide pain. And that's part of a survival mechanism. When it comes to our families and indoor cats, even if they're very happy and they're comfortable with their pet parents, if they're not well, they're still by nature going to hide illness, even from their caregivers. They're territorial, but they can be social. And then lastly, they do require a sense of control, safety, and familiarity in both their physical and their social environments. And that becomes really important, especially when we're talking about lower urinary tract disease. So why do I bring all of this up? Well, we've talked about this a couple times already in this session, that sometimes the clinical signs of lower urinary tract disease are actually quite subtle. And you know, unless we're seeing hematuria or the pet parent notices blood on the floor because the cat had house soiled, a lot of times it takes time for them to notice these changes. I still work on my clients to not leave that litter box in the basement, but that's a common place for it, right? So unless you have a camera or you have multiple boxes around your home, they may not notice some of these very subtle signs until the problem has gotten bad enough that now they notice what's going on. Stranguria, polychiuria, dysuria, these can be very, very subtle. Now, periuria is often a reason that they're gonna bring the cat in, which is house soiling, right? That's when they're usually like, all right, they urinated on my couch, they urinated on the floor, something's up. And so that's gonna be often a reason, but sometimes it doesn't get to this point until things are pretty advanced. I do wanna make a note too, I try to use the word house soiling instead of inappropriate elimination. A lot of clients feel that it's inappropriate, that, you know, this is an inappropriate elimination, they're urinating on my floor, but a lot of times it's not inappropriate to the cat, right? This is a cat who's uncomfortable, painful, ill, and so they're house soiling for a reason. So I think as practitioners, we also should change our mindset and use a little bit nicer terminology, that it's more house soiling, and try to figure out what it is that's caused this cat to not use their litter box. Why is this important? Well, all these clinical signs can be represented by a lot of different diseases. Lower urinary tract diseases the list goes on and on. Now, the majority of cases that we see are going to be those feline idiopathic cystitis cases, or FIC. Urolithiasis is another very common presentation of lower urinary tract disease. But then there's other ones like bacterial cystitis, pseudomembranous cystitis. We can see urethral obstructions. We can see certain types of cancers. We can see behavioral issues for sure, and also neurogenic. And then I also have on here crystalluria, which there are some asterisks there. The reason for that is crystal uria itself is not necessarily a disease. I mean, we can see normal amounts we can see crystals in normal urines. And for somebody like me who does urines daily on multiple very healthy patients, it's not abnormal to see some crystals. Also, there can be artifacts from processing, right, if we leave urine in the fridge. But if I have a cat that comes in that's showing clinical signs of lower urinary tract disease, has a significant amount of crystals in their urine, and they're very painful, that's going to be something I'm going to pay attention to because that could lead to some other problems. I also want to make a note as well that the term fluted, which is a pretty common term that we've used for a very, very long time, is actually starting to become outdated. The reason for that, and it stands for feline lower urinary tract disease, is because that's not actually a diagnosis, right? That's kind of a catch-all term. And so our job as clinicians should really be to think about this as lower urinary tract diseases as a plural, to remind you as a clinician that there's a lot of causes out there that we really need to think about and try to determine what that underlying cause is. So here's a great example of our classic feline lower urinary tract cat that has symptoms. So talking about this particular bladder, we can see this irregularly thickened wall, and it's shown by those yellow arrows. You can see that one section of the ventral wall is quite thick compared to the dorsal bladder wall. We can see a blue arrow that's pointing at this hyperechoic shadowing that could indicate maybe some mineralization. And this cat was ultimately diagnosed with feline idiopathic cystitis. So talking about this a little bit, this is still a link between environmental stress, activation of that central threat response system, and then bladder inflammation and pain. It is a systemic disorder. So we can see lots of organs that are affected by FIC, not just the bladder, okay? And we can see that represented in lots of ways, GI signs and other things. Often it's chronic and it's recurrent. We see this especially in those high stress patients that maybe aren't being managed very well at home with proper environmental enrichment and other things. And then worst case scenario is, especially in our male population, is we can see these cats eventually obstruct, which can be absolutely catastrophic. So what do we do when these cats come in, right? We work through our physical exam. We always want to rule out medical causes first. We want to be sure that this is something medical. Every pet parent thinks that the cat's urinating outside the box because of spite. They were mad they went to work that day. That is not the case most of the time. We're looking at home environment. How many cats are there? What diet are they on? Are we strictly feeding dry food, right? Comorbidities, things like that. We're doing our physical exam. We're usually collecting a urinalysis to figure this out. I put this picture up specifically because this is my new favorite way of collecting urine from cats. I probably do this like 99% of the time. Standing cystocentesis is a great way to collect urine very comfortably from a cat. And then bladder imaging is also super important. So remember, we always should get a full picture of what's going on in these patients. We don't want to skip imaging. And sometimes that is skipped. We get that urine sample and we think we have an answer, but we haven't ruled out all the other diseases. So what does imaging look like? Kind of showed you that example when we started. Cranioventral bladder wall is usually the affected wall in a cat with FIC, but not always. Sometimes that wall thickening can be focal or diffuse. The actual measurements of the walls can also vary depending on how full that bladder is. Sometimes we see a cat that has a very small empty bladder because they're so painful they can't even retain urine. That might have a much thicker, subjectively thicker wall. So keeping that in mind. Sometimes we see mineralization of the wall. Sometimes we see crystal uria, not always. And then in some cases, a very early onset, we may not notice any actual changes on the ultrasound at all. But what the big point here is, this is a diagnosis of exclusion. So we have a disease that we really don't have distinguishing signs. We really don't have any diagnostic test available to us. There's a lot of overlap with several other lower urinary tract signs or diseases that we see. And so we always want to make sure that we're fully working these patients up. Just because a cat had FIC once doesn't mean it has FIC the second time. And so with that, transitioning to how do we use these new technologies to help us detect these signs early, because we know that delayed diagnosis can really be problematic for these cats. What do we do? And we have litter box monitoring technology. And what I want to share with you guys today is how I've had several cases where this has been absolutely life-saving for some of my patients. And I will sing praises for litter box monitoring every day because of this. So I'm going to start by introducing you a couple cases. Ash is one of them. He is a 4-year-old now, but he was 3 years old at the time of this event, or of when we diagnosed him with his FIC disease. Domestic short hair, had a pretty stressful life at home. He's had young babies in the house, a lot of changes for him. So he was kind of set up for dealing with this disease, and we did the best we could with, trying to make some changes at home. But we had him started on a litter box monitor, because one of the big things for him was one of his events that he came in, it actually took almost a month to get him through his FIC event to get this resolved. And sometimes it can be really challenging to treat these cats. It can take a long time. And so our goal was to try to catch these episodes a lot sooner. And so here was an event where he'd been doing great, and she would always call us if she had concerns, but there were 13 events that were identified by the litter box monitor overnight. And the events meant that he went in the box and didn't do anything. And you can see, I've got highlighted on there, if you guys can see that the times that the cat spent in the box also started getting longer. I mean, at one point he was in there 6 minutes doing nothing. Nothing happened. And so she actually called us first thing in the morning. She was very concerned that this guy may be having another event, but actually he was obstructed. And so he, as you would expect, he also had an injury at some point in his life. We won't talk about that. But so he was an obstructed cat, right? So this was somebody who was able to be alerted by her litter box monitor that this cat was in and out, using this box, spending long periods of time. And so here he was with treatment, and I have to say, like, one of my technicians' favorite things is when the urine gets initially put in the bag, they like to say what type of wine they think it is, like Merlot. We never want Merlot, we want Pinot, something like that. This was our first Chardonnay, unblocked cat. Okay, like, this is awesome. This is what you want as a practitioner who, when you have an emergency coming in, you actually have a chance to do something and not be terrified that your patient's gonna die before you even can do anything to them. So this was a situation where this cat was obstructed, but it was caught super early. He didn't even really have any hematuria in his urine grossly, that when we were able to treat really quick. Switching gears, here's another young cat. This is Ace. Ace is a 4-year-old male neuter ragdoll who, when he initially was a very healthy cat. So he comes in every year. He's got a great pet parent who brings all of our cats in every year. They always get annual lab work, full physical exam, whether they're due for vaccines or not, really understands how important it is to have preventative care. Had his annual exam and lab work 8 months prior to presentation, totally normal. And then he presents about 8 months later for decreased appetite, and she thinks weight loss. Well, he was down 4 pounds, which was very scary for a ragdoll in a period of 8 months. And we started with some lab work and saw some pretty significant hypercalcemia and some elevated kidney values. And so immediately started doing some imaging and found this. And this was pretty upsetting to see that he had several nephroliths and ureteroliths present. And so I don't have time to talk about his entire story. It could take a whole hour, but he ultimately, we moved forward with medical management for him initially. And so our concerns were, if these stones start to move, what do we do about them if they move into the bladder and then potentially into the urethra? And so we put the entire household, because she did have several cats, on litter box monitors. And so we had several of them. She had several boxes. Now, this is less than ideal. She had 4 cats and only 3 litter boxes, but hey, we have a couple, we're good. And she also had actually one of the cats in the home. Avit was a cat who suffered from FIC. So this was a great opportunity to have some healthy cats being monitored. We have a cat who's at risk for obstructions, and then an FIC cat. And so got her set up, and just a great example of, you can have multiple litter boxes, you can have multiple monitors in multiple cat homes. So it does work. And she has been watching him for several weeks. He was coming in for imaging occasionally, but this was the biggest change that happened. All of a sudden one morning, she woke up, got up, opened her phone, and her litter box said, hey, the past 3 hours, Ace has been in the litter box several times and hasn't done anything. And this was really different for him. He was a very regular urinator, and so she was very worried. The other thing was, all of a sudden his weight went up, which has been a slow process. We were working on weight gain back, but this was a big jump. And so she actually brought him in right away. And he was obstructed. So he had actually passed several of these stones. He still, you can see, has many left to go, but he had several stones that moved into his bladder. There's one there by the trigone. I have a couple of arrows pointing them out. There's 2 actually in his distal urethra as well, or pelvic urethra. That had obstructed him. And so within 3 hours, she knew that these stones obstructed him. And for this guy, his kidneys and his kidney health is very, very important. We do not want him obstructed at any moment. And so we were able to fix this pretty quickly. And so this is something, again, where these high critical patients, we can watch very closely for changes. Now I'm going to shift to a different type of case, and this is actually courtesy of Dr. Quimby. This is Lily, one of her old ladies with chronic kidney disease, who was very well managed for quite some time, had a litter box monitor in her home, and then all of a sudden had this drastic change. Her urination habits changed, and things were different. She also had a little bit of change in her weight. And so this was one of her monitors. And you can see on this screenshot where we have a consistent yellow line, that urinations, that all of a sudden starts to increase and go up. She also had an increased number of these non-events. And it's hard to see because it overlaps a little bit with that yellow line, but it's that gray line that shows that this cat is in and out of the box again more frequently. And then we have some weight loss. And so unfortunately in this case, what ended up ultimately happening, what she was prompted to come back in, was she developed a tumor. Now this is not hers, this is another cat with a bladder tumor, but something changed, totally different, totally off the rails, would have been expected, right? We've been watching this girl pretty consistently, but again, if we assumed it was an infection or maybe a cystitis event, we could have missed that. So making sure we're catching these things early is super important. When we talk about bladder neoplasia, and I'm just going to put a plug for why this is important too, it's super rare in cats. We really don't see a lot of it. We're transitioning to from the phrase transitional cell carcinoma to more urothelial carcinoma, so that's what we're calling it. It is the most common presentation. Now there are other types like lymphoma. Lymphoma is quite rare. You do see it occasionally. I've seen one in my career. It looks very similar on imaging to urothelial carcinoma, but most common, this is the type we're going to see. The big thing that I want to point out is in a cat is very different than your canine counterparts in that most dogs are going to have that trigone area affected, but in a cat it can be anywhere. And so what that means is that we may not see clinical signs for quite some time. If that tumor is growing in the apical region of the bladder or maybe on the ventral wall, it's not anywhere that's going to affect maybe clinical signs right off the bat. It could be really, really subtle signs for a very long time until this tumor progresses to the point of causing this cat problems. And so what would be great is if we can catch these early, we could potentially intervene medically, maybe surgically, and actually extend these cats' quality of life for quite some time. The other thing I want to point out and tie this into our cystitis cats is that there was a study that was actually recently done in 2020 that looked at 118 cats that were diagnosed with a bladder tumor, and they found that 92 of them had been to the veterinary clinic several times and were treated for cystitis prior to being diagnosed with the tumor. And so again, just that really important point to drive home that sometimes these cats come in for cystitis, they might come back again, it may not be the same thing. So trying to fully work these cats up every time and trying to catch these diseases early is really the key to everything. So summarizing this and kind of bringing this home, remember cats hide illness, they hide pain. So these boxes are such a great way, or these box monitors are a very, very good way to catch these diseases early and catch those very subtle clinical signs. FIC can be such a problem for these cats. They're painful, it affects their welfare, and can lead to life-threatening obstructions, right? So we want to try to treat them as soon as we can. And then ultimately weight changes can be caught sooner. And this is actually my own cat. She was enrolled in some of Dr. Quimby's studies. She did the defecation study. She was your classic every other day pooper. But she was doing great, and then all of a sudden the litter box monitor started telling me, hey, she's down in weight, hey, she's down in weight. And of course I was the veterinarian, and I was like, no, she's probably fine, not a big deal. No, she kept dropping in weight, and finally it was like yelling at me like, this is bad, she's down a lot. And I'm thinking, well, everything else is fine, like she seems to still be eating. She ended up having lymphoma right in front of my eyes. It just happened. And so again, I am so grateful for having a monitor like this to catch that. And she's doing great now. She's in remission and she's happy as can be, cruising at stage 2 kidney disease again. So I do think this is super important to really think about for really any age, any disease, but especially those cats that have lower urinary tract diseases as well. All right, I think we're out of time. Ready for questions. Thank you.
Okay, we got a lot of great questions, a lot of logistical questions. I think that the audience recognizes that cats are special and you can't just change things on cats.
Yep.
So let's see. First, in a cat with active lower urinary tract diseases, right? Infection, FIC in particular, can voiding events where very little is being produced be misidentified as a no elimination event, or no, because it's the posturing event that's being recorded or interpreted?
So this is a fantastic question. And hot off the presses, soon we'll actually be releasing a model to detect straining, because it is a bit of both. So we want to incorporate that weight of output together with the posturing to be able to better predict that, because we realized that that was a gap. We hadn't previously had enough data. So you saw the enormous amount of data we needed. We needed more data on cats straining in order to fine tune that model to actually detect straining. But right now it would be straining for both urinary issues and defecation issues, because what it is it's showing that they're doing the posturing but not producing an output. So coming soon on that front.
And then another logistical question, a really clinical question. A lot of the cases that you all have been discussing have very dedicated owners, but how do you balance the need for this data and how life-saving it can be with the pet parents who they're not that observant, or maybe they don't want to purchase a litter box monitor, for example? Can you get alerts straight to the veterinary clinic on this data? Like, how does all that work?
As like the practitioner for those probably more healthy population than what you see. I mean, we come across that, right? We have some of those that come in for their annual exam and that's all they want to do. I think that some of those pet parents that might be a little more aloof or don't want to do stuff. These are the perfect people to talk to about this. Maybe they're really busy lifestyle. They have lots of kids and they're busy and they're never home, and they have these cats that you really just want to keep a close eye on. It's always worth a conversation. And I think the way that the world is going with technology and AI and making everyone's life a lot easier, this is a really great investment to think about for some of those busy households or people who maybe don't pay as much attention. I know, for as far as the second part of that question, should the vet clinic be alerted? I know that's like the last thing a veterinarian wants to hear is like, it's one more thing that I have to check on the back end and see how things are going. It's one of the features that I actually really appreciate about the litter box monitor that I use, is that it's an app that the pet parent gets alerts for. And it's gonna alert you. It's gonna keep yelling at you and telling you, hey, there's a problem here. You better call your vet clinic. That's all I want. I want them to be told there's an issue, because they're not monitoring their cat. They're not watching what's going on. I want them to get that alert that then prompts them to call me, and I can tell them that they need to come in. Because I don't have time, and my techs don't have time to monitor on the back end. That's what's the beauty about this.
Excellent. And we have a question from the audience.
Thank you. This is slightly off topic of the actual litter box, but for Dr. Quimby, I was wondering in regards to the constipation, plus also hypokalemia, weight loss, the hydration status. What are your thoughts or recommendations for placing esophagostomy tubes in earlier stages of CKD so we can put water in it, make sure they don't lose weight, all those kind of things? Just I'd like your kind of viewpoint on that.
Yeah, you bet. I mean, that's a huge question and a very valuable tool. So people will often ask me at what stage is X appropriate, and it's cat dependent, right? So are we struggling with nutrition, hydration, medications in this cat, regardless of what stage they are? And would that be a valuable tool for that particular patient? So we absolutely do have that conversation with the caregiver in terms of, if you are really struggling, again, it's not for everybody, but if you are really struggling to medicate, or we can't give sub-Q fluids, oral water is always better, right? And then we are really doing the best by the GI tract in that way. So it's an individual determination for each cat, but it's definitely on our list of things that we would recommend. And it's not a certain stage. I would rather be proactive than waiting till when we have a very steep uphill battle. So we absolutely have those conversations.
Are you all in line to ask questions? Go ahead and ask your question if you wouldn't mind.
First of all, thank you all so much for the amazing lectures. It's really inspiring. There was a comment made earlier that the acceptance of weight loss in thin cats or those with lower body conditions is, again, less tolerant than maybe those of a fluffier body condition, if you will. And so I was wondering if you could share a little bit more, Dr. McGowan, on if there is a certain percent that is accepted, because in my experience, any weight loss from a feline should be triggered or targeted. As a nutritionist, but also as a feline pet parent, I know that if they are not actively trying to lose weight, I want to know instantly if my obese, my thin, my emaciated patients are losing any bit of weight. So I am not tolerant at all of any weight loss. Can you expand on that a little bit for me, please?
Yeah, so those thresholds were set for the actual alerts that we're sending to pet parents. We realized that veterinarians might want to see all fluctuations, so the ability to share that data we're working on right now. It's a bit of an engineering feat that we have load cells that can support the weight of a litter box plus all of the litter plus the cat on top, so they need to be robust, plus cats jumping in and off and on top, all that. But also with enough finesse that they can actually detect things like the very subtle changes in weight and elimination patterns and all of that. And because cats are cats and sometimes they're halfway in the box, halfway out of the box, all this stuff, if we were alerting every single fluctuation in weight throughout the day, you'd be getting nonstop alerts. So instead what we're looking at is trends over time, and then we've set things like if you're seeing pretty much any % change consistently over a certain number of days, you'll get an alert. Otherwise, it's set for like a healthy weight loss of no more than 1% or 2%, depending on the time. We've actually worked with our internal veterinarians within Purina and then also several of our veterinary colleagues that we're quite collaborative with to try to set those thresholds to be reasonable. And then we're fine tuning as well as we start to get these use cases where you guys show us like, okay, this data was helpful, we need this, then we can modify the alerts. We're very accepting of feedback from veterinarians to say, this is where we would love the alert to be set. But alerting every single change would be almost every event. And you kind of saw from the graphs, like because of the change in posture, litter kick out, how much they're depositing, all this stuff, like there's changes that occur just part of the normal variability of measuring something off a load cell. And so we've erred on the side of trying not to be too annoying because we don't want people to shut us off, but being conservative enough that if we do see a meaningful change, we are alerting. And annoyingly, I guess, because you said we're yelling at you all the time about shifts in weight.
And I apologize. So I too definitely monitor trends because of those natural fluctuations.
Yeah.
But I guess my pointed question is, if you have a patient that is losing within what we determine to be the safe range of weight loss, but they are not actively on a weight loss plan, is that something where we can be contacting or resetting the threshold? So if the pet parent says, yeah, they're overweight, they are losing weight, if they're not actively attempting to lose weight, I still want to know about that.
Yeah, right now we've set categories for those cats that would be more critical, where like any change would be alerted if it is like a geriatric cat or a cat managing a pre-existing condition where any weight fluctuation should be alerted. But for general cats, depending on the BCS, it's probably the 1% is where you're going to get the alert.
My feedback would be consider a weight loss mode.
Yeah. Okay. I would also say that I think communication with that caregiver is really important. Like I work with them and making sure they're aware of what the information that I'm particularly interested in from the app. And from the personal caregiver standpoint, I would say it probably over alerts me I do occasionally titrate my cat's weights, and so I have an idea of what trends I'm expecting, but I just go through the alerts and say, okay, do I care about that? Do I not care about that? Was I actually trying? But so in that context, I will tell that caregiver, I don't want to see this. Like if this is happening, then that's an alarm for you to let me know, or I want to make sure this defecation frequency is our treatment goal. So we have those conversations to be able to better pull the data and make sure they're aware of the importance of what they're looking at, so that again, they can reach out to us when there's a concern.
And Dr. Quimby, I love that you added that because client communication is just so vastly important in what we do.
Yes.
Yeah, and just one more comment too, like one of the nice things that it will do, so it weighs them every time they're in there, and you do talk to the pet parent about watching that, but it will say, like occasionally it'll give you an alert like, hey, over the last 4 weeks, the cat is down this percentage of body weight. You should probably look into that. It gives you those like.
So I actually have them. I tested them 10 years ago when they were coming out, and it tracked my thin cat, so we were able to recognize that her CKD was progressing, but for my overweight cat, it thought it was appropriate, and she had hyperthyroidism. And so that was kind of the point here, is that for cats that they recognize it's overweight, having some sort of feature where we can say, hey, this is an active weight loss plan versus they're not, could potentially be something to consider.
Yeah, that's great feedback. Can we connect afterwards so that
Absolutely.
I can?
Thank you.
Yeah,
Thank you
I'll
so
take
much.
that back.
All right, so there are several behavior questions that I will kind of combine into one question for all of you or any of you to answer. So it's been noted by the learners that there's a lot of behavior information being collected here, maybe just inadvertently. And so for Patrick, I was struck by the fact that his box was so small he couldn't cover. Not that he didn't want to cover, but he couldn't physically cover unless he got in like a dog and pushed it between his legs, which I've never observed a cat or read a study observing a cat to do that. So Patrick goes to see Dr. Saffire, and Dr. Saffire says, this box is awful. You need to get an appropriate box for your cat. What behavioral observations are you collecting from the litter box monitor that show that, or don't show, that Patrick's innate behaviors in elimination have now changed? Eliminating more, digging more, scratching more, sniffing more, or less, or whatever.
So I'll start.
Yeah, go ahead.
Just so everyone knows, Patrick has access to 6 boxes in his house. That's his preferred one, and it is the smaller one.
Well,
But
there's lots of reasons for that we could argue. If they've got
I
6
know.
boxes, they've got a lot of cats. So yeah.
actually, she has 1 cat and 6 boxes.
Really?
Hyper cat owner to make sure, because she has dogs and she wants to make sure Patrick has access to the litter
dogs.
box everywhere in the house.
Dogs will do it every
Anyway,
time. Yeah.
but Patrick does use all the boxes, but that's his preferred and the one that we pulled the clip from. But we are catering recommendations to pet owners, because a lot of people will have just healthy cats, but need recommendations on proper litter box setup, including proper size, proper location, proper type of litter, shape of litter box, all of these things that are very particular for cats. And so right now we're guiding people towards information that we provide in web form. But we're actually working right now on what we're calling a catisfaction score, where we're actually going to help coach people by looking for those subtle changes in their cat's behavior to coach them to be setting up the litter box in a way that is more cat appropriate. And so we really hyper-focused on the health at first, health and weight, because those were immediate needs that tie to a lot of the nutritional interventions or veterinary interventions that we can get to. But we realized that this is a very valuable tool just for tracking behavior in the home. So now you'll see that there's be more and more releases out that are more just about focusing on the education around cat elimination behavior and proper litter box setup. So I'll pass it to you.
Well, yeah, I mean, my comment was more going to be that that's such a great, like right there, just shows how much we could use this to our advantage, that we don't even know what we can use it for yet. I mean, right now, a lot of these boxes or monitors are being used for disease patients that we want to watch extra closely. But I mean, what a great avenue to go into where you have multi-cat homes or you have issues that you really want to help this pet parent see the positive response to making changes. We put these boxes out, these monitors out, we make some changes, and look, these cats are using the box more regularly. They're having more normal patterns of, you know, defecation, urination, things like that. So I feel like it's something we haven't even like gotten to yet, that like I already have like ideas for projects that we can like look at next. Like, you know, I mean, it's really exciting to see how you could use it to your advantage in a positive way, that we make these changes and these cats do better. Because I mean, I see situations where a cat will come in and they're like, well, I don't know where it's going, but it hasn't used the litter box in 2 weeks. And you're like, well, you know it's going somewhere because it's standing here in front of me. Yeah. So there's something wrong with your situation at home. We need to dig into that deeper. But how cool would it be to say, I'm going to put these monitors on these boxes, that here's the changes we're going to make. I want you to show me now in 2 weeks what this looks like and how is this cat, you know, doing better at home. So
Yeah, I'm going to have a talk with my cat because I don't want a low catisfaction score.
no.
Yeah, I'm going to have a conversation. So do you see differences in defecation trends based on iris stage?
We don't yet have enough data to get at that, actually. So our first goal with the study was comparing healthy to disease, obviously. And then from here, we're now engaging into a larger study and also interventional study. So that was really our first take. But what's interesting, actually, is some of those cats in the study were, in fact, pretty early stage cats. So you would have thought that, in fact, this didn't make a difference until later in the disease process. Which actually struck me was that even some of the really pretty early stage 2 cats actually already had decreased defecation frequency. So I was kind of struck by the opposite. Like, I think it's pretty clearly what we would expect later on, but in fact, you're already potentially getting slower transit early on.
Fantastic. Well, I'd like to thank Dr. McGowan, Dr. Quimby, and Dr. Saffire.